My name's Marie and I work within the Evidence for Action team here at the NDIA. And our work really focuses on bridging the gap between what we know and what we do for the benefits of our participants and the agency. So following on from Lizzie and Rebecca's presentations, I'm going to talk you through one of the ways we've used the research in a practical and pragmatic way to develop new information resources with our participants and the journey that we've been on from conception to publishing, which has included understanding the context of the topics that we're working with and using the available research and participant experience and stakeholder expertise. So the resources we've developed are known as Guides for Understanding Supports, or GUSs, and have been conceived off the back of the 2019 Government Commissioned review of the NDIS Act. This review provided 29 recommendations, one of which was to provide participants with evidence-based information about disability supports. Providing evidence-based information to participants is not something that the agency had done previously. So with the recommendation as our platform, we were charged with developing accessible resources that would be relevant to participants' goals, would increase participant interaction with evidence, and ultimately inform our participants' decisions. Our approach had two objectives. The first, to identify the best approach to developing evidence-based resources for NDIS participants to support their decisions and choices. And the second was to develop the actual information resources. So drawing heavily from the research on decision support tools and health literacy, we began by looking for what was known about the use of decision support tools for people with disability. We undertook a review and spoke with our participants and resource developers within Australia to help us identify what the best approach to take. And our inquiries found that the development and effectiveness of decision support tools in the context of disability is not well documented, and most of the research is being conducted or has been conducted in healthcare settings. So it was clear that we needed a tool to help facilitate the use of research evidence, because while providing people with information is really important, we also need to be able to help them to use it. And our participants helped us to understand their information needs in terms of the content, structure, and format of the resources that we would be developing. So our approach to developing our GUSs adapts what we know from what's been written in healthcare, in that decision support tools can improve people's knowledge, reduce decisional conflict, improve the compatibility between the options and their personal values, and also help reduce indecisiveness when making a decision about specific therapies or supports. To replicate the benefits seen in healthcare, our plan was to develop evidence-based information in an online format and then accompany this with a checklist that participants can use when implementing their plans. So to date, we've published 3 sets of guides, which include employment supports, early interventions for children who are deaf or hard of hearing, and our most recent set of guides is for social and community participation supports for adults on the autism spectrum or living with an intellectual or psychosocial disability. For each of the guides, we've used an evidence-based approach to translate the evidence into a usable product for our participants. As the slide shows, our GUSs are developed using a two-phase approach. So we begin by scoping the guide using a prototype, and this helps us to identify the available research, understand our key issues for participants, identify our key subject matter experts, and also gather internal business advice. The prototype then becomes a document that outlines the proposed guide and the content that will be included, the available research evidence we intend to draw on, and participant stories to provide context for who and how the guides might be used. Engagement with our stakeholders is essential in this process, at both prototype phase and in drafting the content of the GUSs. So for the social and community participation set of guides, we began our development by reviewing the findings of the systematic review and the results of the mixed methods research, which you've heard about today. We also talked to our participants through focus groups about their experiences when choosing supports for social and community participation goals, and if they thought that the drafts of the guides that we presented them with would be helpful in better understanding the available supports. Our participants' feedback helped us to refine the navigation of the guides and how they could be disseminated and used. And they provided information about the content to include, emphasising the need to highlight supports that help people to connect with others and really feel included, as well as the benefits of accessing mainstream community supports. They wanted us to also include actions and prompts for where to go next, what questions to ask and who to ask. So all this information has been included in our guides. We also spoke with and received feedback on the guides for relevant peak bodies across the 3 guides that we've since developed. So based on the translation of the research and participants' experiences, needs and preferences, our Guide for Social and Community Participation Supports is presented as a set of 3 guides to reflect the participant pathway. So as you can see, it includes getting ready for social and community participation, connecting with social and community activities, and staying connected with social and community activities when life changes. Based on some feedback and input, the resources are published online and they're in plain language with the ability to print hard copy if needed. We've also got easy read and videos coming and in development for these particular guides. So supporting the guides on a landing page, we've got information for participants about what they might need to know first. And this information covers how to use the guides, what we mean by social and community participation and why it's important, how the guides can help our participants work towards their goals, where they can go to get more information, how they can record their choices. So this links through to our checklist, which I'll talk about shortly, where they can go to find a provider, and also a section on where the information has come from that these guides is based on. So each of the 3 guides in this series for social and community participation all follow a similar structure and highlight how the guide can help and what we mean by getting ready or connecting or staying connected. They outline the available support options based on what the research shows to be beneficial, and also include, where applicable, the research in detail. So this level of information has been included at the request of our participants, who told us that they were interested in reviewing all the available research evidence, while some still preferred and required just the plain language summary. So we've tried to cater for everybody's needs and preferences. The guides also include a section on who you can talk to and what questions to ask to help start conversations to find out if the programs or activities or opportunities that our participants are looking at are right for them. So as a direct translation from the evidence base on decision support tools or decision aids, each GUS links back to a checklist. The checklist we've developed is a mechanism to help increase participants' interaction with evidence, as well as a tool to help action their choices, decisions, or need for more information. This checklist is interactive and it's online and has space to document a participant's goals, the supports they might need to work towards these goals, what things might help them to further understand the supports that they're looking at, a space to record the pros and cons for each of these supports that they're considering, and suggestions for who they can talk to move on to the next steps. So having launched our first suite of guides in April this year and the others earlier this month, participants are starting to access these resources and provide feedback through our online feedback portal. And so that we can contribute to what's known about evidence-based information provision for people with disability, we've developed an evaluation framework, which is looking at the usefulness, use and impact of the GUSs for our participants, in particular user satisfaction and use in plan implementation. So work on the evaluation is currently underway, and we will hopefully have some preliminary results towards the end of the year. So for anybody who's interested in having a look at these resources in real time, the link to where you can find them is just on the bottom of that screen. But as Rebecca said, we'll be handing out some links to all the resources that we've all talked about today a little bit later on.